Hello, my name is Adia. I'm one of the senior physiotherapists at Essex Physiotherapy Clinic. I'm here today to talk to you about keeping our lungs healthy in this time of where we're going through the coronavirus epidemic. So just want to reiterate that it's very important for us to keep our lungs healthy, to keep breathing and to expel any secretions that we might accumulate. So a lot of us will be working from home, and that will mean that our postures while we're sitting at a desk or working on a computer might affect the way that we breathe. Also, if you have any respiratory conditions pre-existing like COPD, asthma, bronchiectasis, bronchitis, emphysema, cystic fibrosis, lung cancer, or any immunosuppressive diseases, you might be more susceptible to some of the chest conditions or worsening chest conditions. So the anatomy of our lungs consists of our nose, which is a valuable tool in helping us breathe. The nose helps to filter the air of dust particles with the hair. It also helps to warm up the air and make it more moist. The trachea is the airway, so from the back of the nose, it will go into the main airway, and that main airway will split to the left and the right to provide the left and the right lung with oxygen. These two main airways will branch into smaller airways, and the small airways are then have little airbags or alveoli, which is very rich in a network of blood supply. This then helps to take the oxygen that we breathe in to be converted or transferred into the bloodstream, and then the body can use the oxygen so that we can then blow off the carbon dioxide. So the carbon dioxide will flow from the blood vessels and will be transferred into the lungs, and you will blow it out. We also have little finger-like structures in our airways that also help to trap dust particles. And there's a layer of mucus that sits on top of these hairs to then trap even finer particles and help us to clear the mucus on a daily basis. Inside the chest cavity, we have the two lungs and also the heart. And we forget that the heart is part of the breathing apparatus because it's the heart that ultimately pumps around the beautiful oxygen that we've taken in and help us to pump the carbon dioxide back into the lungs so that we can blow it off. The diaphragm is like a dome-like structure that sits right underneath the rib cage, and as it contracts and relaxes, it moves up and down. So the other muscles that helps us with breathing would be the intercostal muscles that are situated between the ribs, and they help to actually move the rib cage and open up the chest cavity so that there's more expansion for the lungs. And then we also have our accessory muscles, which consist of the neck muscles and also the shoulder muscles. So you will have seen someone who's very breathless that they pull up and down their shoulders. So I would like to teach you some deep breathing exercises that will help to get oxygen into the lungs. And it helps us to use our breathing apparatus more effectively. And it will also increase our lung capacity. So in other words, the amount of oxygen that we then have available to distribute to the rest of the body. The best posture for doing your breathing exercise is either being upright in a sitting position or half laying on the bed, propped up with a few pillows. The ribs work as a bucket handle. So if you imagine the bucket has the handle on one side and the ribs will move up and down, it will increase the capacity as the handles move up, breathing in, and down, breathing out. Now the ribs are much bigger at the bottom of the lungs and smaller at the top of the lungs. So it's better for us to get air to go all the way down to the bottom of the lungs rather than just using the upper parts of our rib cage. When we get breathless, we tend to raise our shoulders. And again, that reinforces that we only use the upper parts of our lungs rather than using the full capacity of our lungs. And therefore, it's again vitally important that we use more of our lung capacity. To increase the pressure of the breathing, we can use pursed lip breathing. Now that means just pushing your lips together as if you're going to blow out a candle. And that will help to equalize any pressures in the lungs, and it will help to actually slow down your breathing. So there are two types of breathing exercises that I'm going to teach you. One is diaphragmatic, meaning that you use the diaphragm as the main muscle to get the breathing going. And then there's also lateral costal breathing, and that means you're using the ribs and the muscles of the ribs to actually help you with your breathing. So if I demonstrate the first one, which is diaphragmatic breathing, now throughout all of the breathing, I would like you to take the breath in through your nose, let the air go all the way down the back of the throat, all the way down to the airway to the left and the right, and feel that you're getting the expansion at the bottom of the lungs rather than just focusing on doing an upper low breathing. So if I show you diaphragmatic breathing, so I'll be slightly on the side. So here we want to focus our attention by getting the diaphragm to move up and down and push the belly forward. Now we're not going to suck in when we breathe in, so it's not that, but it's actually the opposite. So if you place your hands very gently on your tummy, and you will feel when you take a deep breath in, your tummy will actually expand forward, because that is where the dome of the diaphragm will actually push down, and it will actually push on your intestines and therefore push your belly forward. So if I demonstrate a deep breath in through your nose and breathe out through your mouth, and a deep breath in through your nose and out through your mouth. So you can repeat that 4 or 5 times, and always try and do this sitting down. Don't do it standing up because you might get lightheaded. For lateral costal breathing, we're going to place our hands right at the bottom of your ribs, and that will give you just some guidance as to where the air needs to flow. Might be useful sitting in front of a mirror to try and do this, because that will give you some guidance as where the movement is happening. So for lateral costal breathing, we're going to do exactly the same. We're going to breathe in through our nose and get the air to go all the way down and expand the chest sideways to increase the capacity. So if I demonstrate, in through the nose and out through the mouth, and in through the nose and out through the mouth. And again, you can repeat that 4 to 5 times just so that you can get some nice breathing going. To help us clear secretions, we can then use the deep breathing, but also techniques to try and loosen up the phlegm or expel it. If you have a cough, it's important that you keep coughing. I know it's annoying and we don't want to do it, but coughing is a protective mechanism. It helps to get rid of those secretions in your lungs. We don't want it to stay in there and fester or cause more infections. So if you do cough, please cough it up, spit it out in a tissue, and discard of the tissue by flushing it down the toilet or throwing it away in an appropriate bin. Our lung capacity can be reduced if we don't get rid of these secretions. They can build up in the lungs. And if you can imagine like a half bottle of water, there is air at the top of the bottle of water and all of the water is at the bottom. So gravity will make that all of those secretions will sink to the bottom of our lungs, and it's then very hard to cough it up. So we can use huffing techniques that will actually help to vibrate the phlegm, loosen it up, and help you to cough it up. So you will start with 4 deep breaths. So your normal deep breaths, like you did either diaphragmatic or lateral costal. So I'm going to do lateral costal breathing. So I'll go and then you wait 4 or 5 breaths just to get your breath back if you are breathless. And then we're going to do a huff. Now I like to do a medium huff first, just to see if I can get something moving. So if you put your hand up in front of your mouth and you imagine it's something between a cough and making a little steam on a mirror, you will hear this sound. So a deep breath in through your nose and another one in and do 2 of those, and you will feel that sometimes it will make you cough. If that happens, keep coughing, don't stop yourself. Then you'll wait 4 or 5 normal breaths just to get your breath back. You will repeat the 4 deep breaths like we've done before. So this time you may want to do the diaphragmatic breathing, so 4 or 5 deep breaths doing that. Then you're going to relax for a few breaths, and then we're going to do 4 harder huffs. Now these are just going to be held for longer, and it will agitate the airways a little bit more, so you may find that you cough a little bit more on that. So it's the same technique. So you're going to put your hand up in front of your face, and you're going to take a deep breath in through your nose and huff. And a deep breath in and huff. And again, if that makes you cough, please do continue to cough. So you can do this cycle as many times as you like, because it's not going to be detrimental to you. We all need to breathe, so it's not like you can overdo it, but it will be good if you can do 4 deep breaths, 4 relaxed breaths, 2 medium huffs, 4 relaxed breaths, 4 deep breaths, 4 relaxed breaths, 2 hard huffs, 4 relaxed breaths, and then you're back at the 4 deep breaths at the beginning of your cycle. You may find that you start coughing maybe 10 or 20 minutes after you've done the cycle, and that's normal, because then it means that the phlegm in your chest has started to move around. Please try to do these exercises before you have a big meal, because it may make you feel a little bit sick. So don't do it on a full stomach. Some additional advice that I can give just to help us clear our lungs is that we need a lot of water. So we are staying indoors, we're not getting as much fresh air, we are having the heating on, so our airways might dry out a little bit, and we might be a little bit more dry. So if we don't drink enough water, the secretions will become very thick and therefore become more sticky and difficult to bring up. Lemon and honey in some boiling water is a nice remedy to just help us clear some of the phlegm out in the back of our throats, and it feels a bit more soothing. If you are using inhalers, please continue to use them throughout. Don't stop them, and make sure that when you use your inhaler that you're taking very deep breaths and getting the medication to go all the way down to the bottom of the lungs so that they can work a little bit more effectively. If you find that you're very breathless, there are some techniques that you can use to help you feel less breathless. And the key thing here is to try and slow your breathing down. It may mean that you want to lean forward with your arms resting on your knees when you're sitting down, or if you're standing up, you can use your hands to lean forward and either rest on a couch or a surface, or with your hands on your knees. Deep breaths, again, even though you're very breathless, may just mean that you have to slow down, and just maybe one of those breaths to take a nice deep breath in through your nose and purse your lips and breathe out before you continue with your hyperventilation. Keep exercising. That will also help your lungs to stay clear. So if there is any way that you can do some exercises indoors, then please do that. If you have any nebulizers or inhalers or steam, that may also help to loosen up some of the secretions. So please do use them as they were prescribed to you. And then don't panic. It feels awful when you're breathless, and it's very easy for us to get panicky, but please try and remain calm and breathe as deeply as you can. If you do bring up any phlegm, please remember to cough it up, spit it out in a tissue, and discard of it appropriately. If you do need any other information, you can always contact us at our clinic in Essex Physiotherapy Clinic, and the number there is 01245 325 037, or check out our Facebook page at Essex Physio, and our website is essexphysio.co.uk. Thank you for watching, and we look forward to seeing you soon. Bye-bye.